here with a genetic counselor, Chelsey Weatherill. Hi, Chelsey. Thank you for being here.
Hi, thank you for having me.
I'm going to give a brief background about your history and how you ended up being a genetic counselor, and then we'll jump right into 5 relevant questions that the public needs to know.
Sounds good.
Chelsey Weatherill graduated from the University of Alberta with an honors degree in molecular genetics. She received her master's degree in genetic counseling from the Icahn School of Medicine at Mount Sinai in New York City. Chelsey is board certified as a genetic counselor and licensed in the state of California. Chelsey has been a genetic counselor at Hoag Hospital since 2018, and she sees patients for cancer, cardiovascular, and other adult general genetic indications. So, that being said, I was able to visit her department and have had the privilege of seeing your team, and they are spectacular. Our community is so grateful and lucky to have you guys. So, thank you.
Thank you for your kind words.
Is there anything you want to add before I jump to our first questions about your training?
No, we can get started.
So that brings us to the general question of who deserves genetic counseling and hereditary cancer screening.
Yeah, so a lot of people always ask that, when should I see a genetic counselor? When should I get genetic testing? And we like to kind of break it down thinking of what are some of the red flags in a family history or a personal history for when someone should be referred for genetic counseling and testing. And so the first one is young age at diagnosis of cancer. So, if either you or someone in your family was diagnosed with cancer at a younger age than what's typical for that cancer, we would recommend genetic testing. So, if we're thinking of breast cancer, we'd say 45 or under is considered young. For colon cancer, under 50 is considered young. Same thing for uterine or endometrial cancer, under 50. Those would all be considered early onset and would be a good referral for genetic testing. The next thing to look for in a family history is rare cancers. So, specifically, ovarian, male breast cancer, and pancreatic cancer are considered rare cancers. And one of those in a family at any age is enough for a referral for genetic testing. They found that about 1 out of 8 ovarian cancers is hereditary or due to a genetic risk factor. So, we definitely want to see the families with the history of those. Another red flag we look for is multiple diagnoses in the same person. So, it kind of feels like, why me when someone gets cancer once? And if they get it twice, that's very unlucky for one person to get 2 different types of cancer. So, then in those cases, we think maybe there's a gene to blame rather than just 2 cancers by chance. So, a woman with breast and ovarian cancer, someone with colon and uterine cancer, a woman with bilateral breast cancer, so 2 separate cancers on each side, 3 or more melanomas in the same person. Those are all some clues. Or pancreatic and prostate in a man. All of those would be indications. Um, Another red flag we look for is ancestry. So, certain people of certain ancestries are more likely to carry gene mutations. Specifically, we see a lot of hereditary cancer mutations in the Ashkenazi Jewish population, so the Eastern European Jewish population. Um, the mutations are more frequent. And then the last red flag is family history. So, if you have a lot of cancers on one side of your family, that are either the same cancers or related cancers. So, what I mean by that is some genes can cause more than one type of cancer. So, a lot of people have heard of the BRCA genes before. The most 2 common cancers with those are breast and ovarian. So, if we see breast and ovarian on the same side of the family, that's another clue or red flag for genetic testing.
Can anyone, as we're expanding our knowledge of genes and testing, can anyone call and make an appointment and get evaluated?
Yeah,
Excuse me.
absolutely. So, a lot of people I see either maybe were adopted, maybe don't know one side of their family history, maybe their relatives passed away young and didn't live long enough to get cancer, or they're just interested and they want to know. So, people can absolutely call, make an appointment, and come and do the testing, even if they don't have any red flags in their family history. The chances are definitely lower that we're going to find something, but we don't turn anybody away. We welcome all referrals.
So as I've been practicing, especially in the concierge world, I see different vendors coming in with their genetic screening tests. And when I listen to what they have to offer, all I can think is, why not? Why wouldn't I do this large panel to see if I'm at risk for these cancers? Would you warn against doing that, or is that going to be possibly the way of the future to just find out what your risks are?
Yeah, that's a good question. So, a lot of the times, if someone meets criteria for genetic testing or they're paying for testing, the cost is the same no matter how many cancer genes they pick, depending on where we're doing the testing. So, we always give people the option. Do you just want to test what you came in for? Do you want to test for what's in your family? Or do you want to do all the cancer genes possible?
Mhm.
And I'd say the majority of our patients choose to do everything. Definitely, you can see the benefits right off the bat. You get more information for your kids and your family. And if you know about your risk, hopefully you can screen more or do things to prevent it. But it's not always best for everybody to do the big test. I see a lot of patients who are maybe going through treatment for cancer and they're really overwhelmed by their current diagnosis or their current treatment, and it's just not the time to tell them that they have a risk for something else and they have to do all these other screens. They might just not want to know at the time, which is okay. Or some people are really anxious about this information. They're worried about finding out something unexpected that's not in their family. So that's why we always let it be their choice and we discuss the pros and cons of it. But you're right, we definitely see a lot of benefits from doing a bigger test, and lots of genetics professionals and doctors think maybe in the future it'll be bigger tests will be more common for people.
So we're kind of sneaking into our next topic, but I'll try to stay focused on who should get testing. Is there anyone that shouldn't get testing? It doesn't seem like there is anyone that shouldn't be tested. I
Yeah,
can't see a scenario.
right. In the world of cancer, we don't always test children unless it's for a gene that would cause a cancer in childhood. And that's because we don't want to take away their right to choose, right? If it's a gene that's not going to increase their risk for cancer until they're in their 30s, then they don't need to know when they're 7. They can wait until they're 18 and decide when they want to know, if they want to know. Um, that way, it just, there's no discrimination on them in childhood if they're positive or anything like that. We would delay. But
So are there exceptions made when it's a childhood cancer that runs in the family? The
yes, that
parents then pick to screen?
exactly. Yeah, if it's a gene that would cause a cancer in childhood, we'll definitely test children because we want to start screening right away.
So the only people then that we would not generally say need to be or generally should be tested are the pediatric population. Otherwise, if people just have only information to learn about prevention or preventing a maybe a late adulthood cancer, if they have knowledge about what they need to get screened for, correct?
Right. Yeah, and I think we're in a day and age where a lot of people want to be proactive with their health and get more information. And if they can do something to prevent it, a lot of people will reach out and ask about like wellness genetic testing and what can I do where I can, learn information where I can prevent something or stay healthier. So I see that, and thankfully we'll get into costs later, but the costs of genetic testing are coming down, so it's more accessible to people. It definitely wasn't like that even 15 years ago. It was definitely not worth it for the people without the red flags because it was very expensive. But it's more accessible now for people who want to know.
Yeah. Okay, yeah, we'll get into the costs later. I do wanna encourage people to really consider what we're talking about here today because especially during the pandemic, we've seen some increases in cancers due to lack of screening, and we're taking it one step beyond, and we're saying, "Okay, let's find out what type of screening would be suitable for you because of your risk." And for me, I turned out to have because my sister at 29 was diagnosed with a terminal cancer, I was screened to be or I was flagged to be screened and found out that I carry a risk for colon cancer. Now, during the pandemic, I did not expect myself to be doing a colonoscopy, but it definitely was relevant for me to go ahead and do. So I actually just got that done this week finally after postponing. But it is something that we in our head say, oh, we'll do it, we'll do it, we'll do it. But you really got to make some time to take care of yourself, because your kids need you to be there. You need to be there for your spouse, and you don't want to be dealing with late stages of disease versus preventing it. So I really am glad we're doing this talk today, because of prevention is medicine.
Yeah,
So,
absolutely. Yeah, I talk to lots of people and they'll say, oh, I was so busy with my kids and their appointments and taking care of their health. And come in for your genetic counseling and testing appointment, and we recognize that. So when someone's ready and they do it, we're glad they come, and they're, you want to be there for your kids, and taking care of yourself and being healthy helps you to then be there in the long care of them. So it's worth it.
And I think kids or no kids, I do see, reaching out to my family and asking the questions about who had cancers. People say, oh, no, we're really healthy. We live till late ages. But you really have to consider talking to your family members. And then for me as a physician, I had a lot of work to encourage other people at risk to go ahead and get the screening. And Hogue couldn't have made it easier, the way they were provided them exactly the reference letter so insurance would pay for it and get it done and get it paid for. So what I'm learning is it's really just about person to person making time for these types of easy tests, such easy tests. And how nice would it be to know that you don't have any known risks that will be, then you just can follow standard screening. So let's talk about, so this is a nice conversation right before we talk about the risk of discrimination, because with everything, it's the risk versus reward. And so the reward is knowing everything you can about your risk for cancers. But then what would be some of the people's hesitations? As we know, it's usually is someone going to say, oh, you have this gene, you're not, we don't want you to work here, or we don't want to give you insurance. Why don't you speak to that, Chelsey?
Yeah, so we're lucky in the US. We do have some protections against what we call genetic discrimination. So there's a federal law, it's called GINA, or the Genetic Information Non-Discrimination Act, and it does prevent genetic discrimination when it comes to health insurance and employment. So if you find out you carry a gene mutation and have a higher risk for any type of cancer, your health insurance company can't turn around and make you pay more or deny you coverage. You can't be fired from a job or denied a job because of your genetic test result. That's all protected by that law, but there are definitely limitations. That law does not prevent genetic discrimination when it comes to life insurance, long-term care, and disability insurance. Meaning basically if someone tests positive, they find out they have a high risk for cancer, and then they try to get life insurance. If the company happens to ask them about their genetic testing history when they're doing their health screening and they find out they have a high risk for cancer, then they might not want to give them life insurance, or they might make them pay more for life insurance. So there is discrimination with that, but I tell a lot of people, I tell them that before they do the genetic testing. And so some people will choose to go get a life insurance policy before they do the testing, and that way it's in place. They'll come back and do their testing. If they come back positive, then they already had their policy in place. They don't have to turn around and tell them at that point. So there's kind of some ways around it if you know ahead of time.
And that's just such an easy solution. So I don't think that there really is a reason not to. You get your health insurance, and then you have lifelong protection anyhow, and then you go ahead and get your testing. I was advised that there's some states that you can get health insurance where they do not ask those questions, like Florida. So that's a good that's a good way to work around it if you don't want to get health insurance, or life insurance. Health insurance, as you said, is protected, which is wonderful.
Right. Yeah. Florida's one recently passed a state law. They can't discriminate for life insurance coverage with regard to genetic testing. So that's, I tell people they could go take a trip to Florida and get life insurance.
And, I suspect this is going to change as more and more people are getting tested and we start learning about other genes associated with cancers, because people do have plenty of cancer mutations that are happening throughout their life cycle. And, when do they cause problems? When don't they? It's all relative, but we will be learning in the next decades just what are cancer promoting genes. And so it's all going to be a continuum of how many of these cancer promoting genes you have. And then everyone's going to have some level of risk. So I think that laws will probably come into play, don't you, that will protect people more and more?
Yeah, I think so. That's the direction we're going. So I'd hope it continues in that way. Um, yeah, I agree.
So on this topic, any other ethical considerations that you would, we talked about the pediatric population, which is very relevant for me in my practice. Any other ethical implications that are to be discussed, legalities that we might have missed?
One of the things I could think of, I'm not sure if it really falls into the category of like an ethical limitation, but with genetic testing, it's not always black and white. Sometimes we get what we call variants of unknown significance. So this is kind of like an inconclusive test result, meaning when they were reading through someone's DNA, they found a variation in one of these cancer genes, but the laboratory doesn't know yet if that variation actually increases their risk for cancer or if it's just a harmless variation that happens to be in a cancer gene. And so, unfortunately, we get these all the time. When I have people do the largest cancer genetic test possible, about 1 in 3 people get one of these inconclusive results. And so, that also can be hard for people because you're kind of in that gray area where do I have a risk? Do I not? Should I do anything about it? And right now, it's recommended that people don't act on unknown variants, meaning, if you have an unknown variant in an ovarian cancer gene, I would hate for that woman to go and remove her ovaries and go into menopause and then find out a month later that her variant was harmless. So those are tricky for people, can make people anxious and worried again. So sometimes, I guess in those cases, people might choose to do a smaller test to lower the chances of getting something inconclusive.
That
But
might be a good route for someone who has anxiety, maybe anxiety disorders.
right, yeah, yeah.
Yeah.
90% of the time, these unknown variants turn out to be harmless. The lab will reclassify them to benign or likely benign at some point in the future, but there are some that go the other way and get reclassified as what we call pathogenic, meaning they do increase risk. So you never know for sure. And we call everyone with the updates. Most of the time, it's a good news call, but sometimes it's not. So we warn everybody.
But this is exactly why somebody went through the testing so that they can know, and knowledge is power. It's
Yeah.
would I that's all how I see it, but I'm a scientist at heart. So let's move to the next topic then. And what is the accuracy and privacy of these direct to consumer genetic tests?
Yeah, so there's a lot of direct to consumer genetic tests out there now. So think of like 23andMe, Ancestry.com, all those ones where you can basically order a saliva kit in the mail and test for something genetic. And I love everyone's enthusiasm about genetics and wanting to get genetic information. I think that's definitely a benefit of these companies. But the downside is the testing isn't comprehensive. So, what I mean by that, for example, 23andMe does test for some variants in the BRCA1 and 2 genes. And so the genes, a way to think of them is a long string of chemical letters. And any sort of spelling mistake in one of these letters can increase cancer risk. And so when people get clinical genetic testing, we check every letter of the gene for a typo or an incorrect letter. Some of these direct consumer companies, they instead of checking every letter, they just check a couple of them. So for BRCA1 and 2 and 23andMe, they look at 3 letters instead of all 18,000. And so they definitely could miss a mutation. If someone happens to have one of the 3 common mutations they check for, they're usually very accurate in finding one of those, but it's definitely not a comprehensive test. The 3 mutations they do check for are actually the common mutations in the Ashkenazi Jewish population. So it's a decent test if you're Jewish, but if you're not, it definitely could miss something. So I would say it's most of the time accurate, but we still recommend confirming with clinical testing, but it's not always comprehensive, is what I kind of tell people. And the other thing is, we know of almost 20 genes now that can cause breast cancer, and they're only looking at BRCA1 and 2. So it's, again, not comprehensive.
Mhm.
Go ahead.
So yeah, these tests that people are doing, they might not even be using them for medical reasons, but it turns out, what happens if these companies find that they have BRCA and they're not, that wasn't searched for? Is there any information being transferred to like databases where they would get back to somebody, or being saved there, someone later can say, oh, do you have that information? Or is it just kind of like a free for all. You sent it in, they gave you the information that they wanted to give you, and you paid your money.
I know there are ways to submit raw data from some of these companies to like a website that you can pay money and they'll analyze kind of the raw background data that 23andMe didn't tell you about. So some people have brought in those results before and showed me that, 23andMe didn't tell me I had this, but when I paid this other company to analyze the raw data, I found this other mutation. And again, that might be even less accurate because they're not even comfortable reporting it to you. So that definitely should be confirmed with clinical testing. With like the privacy and if it could get back to you, like if you didn't want to know and then an insurance company accessed it one day or something. I'm not sure if we're there yet. I don't think they're at the point where they're giving away information to insurance companies, but they definitely are sharing information with like pharmaceutical companies and they're doing research. So your results are not as private and confidential as they would be with clinical grade testing. So that was something to consider. Some of the tests through 23andMe are considered, FDA approved. So even with the life insurance scenario, having a BRCA mutation from 23andMe could also potentially affect someone's ability to get life insurance. So other things to consider before doing these tests because they are accurate tests.
Okay. That's private. So I'm just putting in some notes here.
Yeah.
And then when Ambry Genetics comes with these incredible panels, and you're saying why not just do the comprehensive panels? So my availability and access to these tests is totally open. Are you seeing more primary care doctors sending these tests out? And can somebody talk to their primary care doctor about just paying cash for something like this? Because I want to tell all my parents, do this, please do this. Uh,
Yeah.
I'll order it for you. You're not my patient, but find out what you guys are carrying that you need to live a different lifestyle for. That, I mean, we do that with cholesterol. We do that with other things. Are you a rapid absorber of cholesterol? We know the genes that do that. I do Boston Heart Labs, or there's Cleveland Clinic Heart Labs, and we know what their genetic predisposition is for having heart attacks. Why not know for everything?
Mm-hmm. Yeah, definitely there are more primary care doctors ordering this type of testing, which is great. We want to get the access out there. There's not enough genetic counselors. We just want to make sure that everyone gets the right test and has their test interpreted accurately. So if they want to see a genetic counselor, there are now some of the labs will offer telehealth genetic counseling, which became big during the pandemic. So like I know Invitae too is another one where you can go on their website and you can pick a genetic test and they will help you get telehealth genetic counseling right through their website, and then they'll send you a saliva kit and you can get one of these tests, and it's almost as convenient as 23andMe because it still gets sent to your home and you get the interpretation by a genetic counselor and these people who read lots of these tests, which I think is great. It helps improve access.
Can the general population access some of these tests? And can you maybe list some of the names of the companies? I'm guessing not, but because of the implications, once you have some positives, you really need somebody to help guide you. But can you guide me on some of the names besides Ambry that have these tests out in the public for physicians?
Yeah, for most of them, you can't just order a kit yourself. They'd require you to do some sort of telehealth genetic counseling or review of your family tree by a doctor or something. But Ambry is one. Invitae is another one that works nationally.
Can you spell that for me? I can't hear everything.
INV, as in Victor, ITAE.
Invitae. Uh-huh.
So these labs don't even have to be local to you. Ambry's in Aliso Viejo, Invitae's in San Francisco. They'll send kits across the country. Like you said, I did part of my training in New York, and we sent kits to these labs, even though we were on the other side of the country. So it is accessible. Yeah, those are the two that we probably use the most often for cancer. We also use Myriad Genetics sometimes as well. I'm not as familiar with how their direct-to-consumer kind of patient is set up for that, but they might be as well.
Yeah, it's definitely something that has some ethical implications and would have to be discussed on some boards and panels, and I think have some safeguards. But I think it would be great jumping to 10 years from now.
Yeah.
So, anything else you want to discuss on this topic about the privacy of direct to consumer genetic tests and more about those tests?
Yeah, I guess just the takeaway is that they're not private. They can share your information, they can use it for research. I think there was a serial killer that they caught because one of his relatives did one of these tests and they were able to link the DNA and figure out who he was. So a lot of people say that's a good thing, but
Yeah,
they
I think that's happened more than once.
yeah. So it's just if you're worried about that, the clinical testing is private, it is confidential. I'm not giving your results to your insurance company. The only way they'd get to your insurance company, I tell people, is if you want to prove you said based on your results you are getting more frequent colonoscopies, so you're going to have to show your health insurance company your result so that they'll agree to pay for more frequent colonoscopies. So that's when they would receive it. But I don't directly share your results with your health insurance company.
Got it. Got it. So for like a prior authorization. So then
Exactly. Yeah.
you could even decline and pay cash if you don't want your insurance to have that information.
Mhm. Yeah.
Going to the next conversation, and I'm wondering if you might even talk about genetic counseling outside of cancer, um, just discussing what it entails.
Yeah, so I also do genetic counseling with the Heart and Vascular Institute. So
Got yeah.
really right now in the clinic, it's focused on connective tissue disorders, so like Marfan disease and related conditions like Louis-Dietz syndrome or Ehlers-Danlos syndrome. A lot of those genes are related to like collagen and connective tissue, and if someone has a mutation, they might be really flexible, or their arteries could be prone to dilation and rupture and things like that. We also know of lots of genes now related to cardiomyopathy, or like a dilation of the heart, or arrhythmias and things like that. So I had a patient, or I've had a few patients with like inherited disorders, and so someone in their family may have passed really young due to this, and we found out they had it, and they might, as a management option, have like an implanted defibrillator. So if they ever have one of those electrical issues, it would basically shock them and save their life. So again, that's kind of a big deal. If you find out you carry this genetic predisposition and you can do that to save your life, it's major. um,
Yeah.
General adult genetics, we see a few people, especially if they just need genetic counseling or there's a known mutation in the family and they're just coming in for information and testing. If it is a condition that requires like a physical exam or like a scoring, like they need to measure head size and arm length and things like that, then we would send someone to a clinical geneticist or genetics doctor who could do the exam plus order the testing. Really, as a genetic counselor, we're just providing information and ordering the testing, and we don't want anyone to miss out on the full exam if they need it for whatever condition they're being evaluated for.
So in summary, genetic counseling is meeting with a counselor, looking at your family history, looking at your findings, and then picking out the tests,
Yeah,
the blood work,
pretty
and
much.
and then going over your test. I actually met with a geneticist, so I wasn't sure. I wasn't even trying to make a distinction between the two, but the counseling was the same. She looked at she made a family diagram for me, and then went through who might carry some of the genes that were of risk and concern. Is that is that pretty much the gist of
Yeah, pretty much. So we had people fill out their family tree ahead of time. That might be a difference. So we can assess it, and we run some risk assessment models. So we figure out, okay, exactly what's your chance of having a BRCA mutation or another mutation based on your history, so that when people come in, they have an idea of what the chances are it's going to come back positive. And then we talk about the proportion of cancers that are hereditary, what the red flags are in the family, specific things to their family, what might be risky, what's not, if there's adopted people or a small family on one side, how that's limiting our risk assessment. And then we talk about what we would do if someone was positive. So if you have a risk for breast cancer, you might get a mammogram and breast MRI every year, or like you said with the colon cancer, more frequent colonoscopies or things like that. And then we pick the test, so we decide together how many genes they want to test for, pros and cons, possible results, and then you're right, when we get results back, we make a management plan, we go over what it means for their family, how that gene is inherited, what the risks are to everybody. And for family, we'll write, we call them Dear Family letters. So letters you can write to your family that explain what was found and how you can get testing. We often give people like a USB drive with resources and support groups and the current guidelines for management and all of that follow up. Genetics matters for you and your family. So we want to follow up with everybody and give everybody the information they need.
So having gone through the process, I think a few take-home points for people listening. I was flagged by the breast doctor, the breast radiologist, and then other people mentioned a program for high risk. And I think once you hear it once from one physician that you have maybe a possible hereditary cancer, that that should be enough for you to say, oh, you know what? This would be a wonderful opportunity to get screened and paid for screening and maybe more frequent screening. Of course, it took me a couple times to hear it and say, oh my gosh, I need to go. Hogue has a wonderful system where they actually reached out to me and reached out to me more than once. And I realized I was somebody that was considered high risk and needed to do some early screening. Then you actually did all of the work for me that I needed to get. It's very streamlined. Once somebody says you might have anything hereditary, you should take advantage of that because they're going to set up a system for you that you just follow some directions. You get your insurance in line and behind the program, and you actually can find information about your risk and share that with your family. Your family gets everything paid for as well. And all of this is preventative. It's just going to save you years of your life and of your family's life. So the it sounds like it's a lot of steps, but it isn't. It's one or two meetings. They email you everything. You can read it through it at your own pace. They share it with whoever you do and don't want it shared with. And it makes for a seamless, easy experience. Now, all of my other so when I talked to my GI doctor, he's like, "No, you don't need to be screened. That's nuts." And I was like, "Well, look at the standards in this letter." And I showed it to him. He's like, "Oh, well, we'll do it, and insurance, of course, will pay for it." But he was telling me like he wasn't even that familiar with the gene, whereas the geneticists and the scientists know and can track what my risk was, where maybe the specialist doesn't see it that often. And so you really need to keep your ears open if your physician says, "Oh, this might be a hereditary cancer or a hereditary condition." You should really consider talking to a geneticist. They'll make your life easier and help save a life in your family or for yourself.
Yeah, that's a big thing. We tell a lot of people when we're talking about cancer, the first cancer genes were discovered in the late 90s.
Mhm.
So your doctor went to med school before the 90s. They
Right.
probably did for genetics education. And I'm sure, just like everybody, they do webinars and continuing education credits and things like that. But they might not have a strong background in genetics. And like you said, these mutations are rare. Even the specialist may not have heard of it before. So we tell people, you might have to be an advocate for your own health. You might have to explain this gene to your doctor, but there's a lot.
Absolutely.
There's the guidelines you can share with your doctor and show them what you need. But you might be the one, explaining it to people going forward. But if your doctor has questions, they can call us, and we want to help educate going forward, and so that more people are familiar with this as genetics becomes bigger.
And a lot of things I do, even when I get somebody in touch with a specialist as a pediatrician, I want them in the system because everything's growing, like you said. The knowledge that we have is expanding, and you're going to be in their list of people to contact because you have this condition. And there, as the data gets updated, you're going to be in the know and be the first to have the therapies offered or the screening that's offered. But it is so true that doctors are limited in what's new knowledge about DNA, but we do know, and there's nothing that replaces a good exam and a good history. They always hammer that into your head as a physician. Get the history. What does the history say? The history tells so much. And even families, it's shocking to me how little families realize how important their history is. they'll when I bring something up that I'm finding, oh yeah, so and so had that, and so had that in the family, but that's very significant because that's who you are, and that's going to be who you are, and that's going to tell your future. So yeah, the fact that I somehow now know a little bit more than some of my specialists as far as what I've learned from the Hoag team, and that I'm going to be seeing doctors who are specialized in the genetics. I still have this all day visit with, an OB-GYN and some other specialists, but they're trained better in the genetics of these hereditary cancers. So I don't want anyone to shy away from the opportunity given to them if somebody says, why don't you speak with a geneticist or genetics counselor? So,
Right. I like what you said about the family history. Know your family history. Take a good family history. That's part of the reason we had people fill out their questionnaire before their appointment, because we want you to call all your relatives, right? I'm sure when someone's coming in for their annual visit, you might ask them and you take the history, and then they come to see us and they actually call their grandmother and get the history, and 3 more relatives with cancer might be added before their genetics appointment. So, you know,
yeah, and and don't be afraid if it's nebulous. I think especially with our generation, the grandparents died of some cancer, but had another cancer while they were dying of the other cancer, and they're not sure which one they died from, or there was something in the back of their eye. Those are some tumor, there's certain tumors that are definitely genetic. So you don't need the details, and it's helpful to push things through insurance if you know that somebody passed of a cancer or had a cancer of a certain organ type. The geneticist and counselor can piecemeal whatever they need together to get you what you need.
definitely. Yeah, I agree.
So at our final topic, the cost with genetic testing, which I'll let you speak to, and I'll give my perspective as a primary care doctor.
Okay. Yeah. So at Hoag, when you're coming in for genetic counseling and testing, we do it as a 2-part billing process. So genetic counseling is part 1, genetic testing is part 2. We kind of compare it to someone going in for like a doctor's visit and then they order labs through Quest, right? They have to pay for the doctor visit and the labs. So genetic counseling, the visit where we review your family history and pick your test and all of that, is typically covered by most insurance companies, especially if there's a family history of breast or ovarian cancer. For anybody who doesn't have insurance or it's not covered, we do offer a discounted rate. It's $215 for genetic counseling at Hoag. For genetic testing, same thing. If someone meets criteria for their insurance company, it's covered. If not, it's $250. And that covers as many cancer genes as we know of, basically, that you can test for. So lots of times genetic counseling is covered for people, but they might not quite meet genetic testing criteria based on the ages of their relatives or things like that. So then we offer them the $250 cash rate for testing.
You said 210 for the visit in the worst case scenario, right?
15 for the visit. Yeah.
And then 250 for the testing.
Yep.
Once they do that testing, can you get tested for other genetic diseases that are not cancer? Is there a way to expand that through your department or not?
Not right now. Most of the labs, what they'll do is it's $250 per clinical area. So $250 for everything within the cancer realm, or $250 for all the arrhythmia, cardiomyopathy, all those cardio genes, or $250 for like the neuro genes. So they can't expand between the specialties yet, but for a lot of the labs, that's the flat rate for each clinical area.
Okay, so and the areas that are tested for are neuro, cardio, endocrine, I assume.
Yeah, endocrine. Trying to think. They do. There's like childhood like development disorders, which we don't see pediatric population here.
I
Like
mentioned that. Yeah, okay.
metabolic genetic disorders, carrier for couples who are thinking of having kids, if they want to find out if they're a carrier for any recessive diseases.
Yeah, that was wonderful when you do any screening for IVF. Recessive genes. So yeah, that's what I find too. It's around, it's a little over 200 for these
Mhm.
expansive, yeah.
The other thing is there's a lab right actually Invitae right now is doing no cost testing for individuals with Medicare. So Medicare has really strict genetic testing guidelines, and we're trying to help make those better by showing, or Invitae and these companies are trying to show, look how many times we find a mutation in someone who wouldn't have met criteria, and now we can prevent cancer instead of having Medicare pay for cancer down the line. So I don't know how long they'll do that for, but right now testing is no cost for Medicare. Um, Medicare doesn't cover the genetic counseling appointment, so our Medicare patients do have to pay for genetic counseling, but their testing is, as of right now, covered.
Wonderful. And you can sometimes go to these sites and see all of the things you can get tested for, and you can talk to your doctor about getting tested for them if you've heard. I think it really is important to know that there is some risk factor because you don't need to waste your money on a neurologic disease that you've never even heard of. But if there's some concerns that you have seeing your family and nobody really knows what was going on and why there was maybe a vascular malformation in someone's brain or etc., you might just want to look at what these panels have to offer, and it's all on their websites. And
Yeah, another
mhm.
good resource is findageneticcounselor.org. You can click the different genetic counseling specialties and then you type in your zip code or your address and it can find you someone close to where you live. So if you did have a strong family history of early onset Alzheimer's and you want to talk to someone about Alzheimer's genetics, you can choose neuro, type in your zip code, and it'll tell you the genetic counselors that specialize in that in your area. And so you can meet with them and see, am I a good candidate for the test? Which lab should I test through? And they're the experts and they're going to order you the best test and they know the ins and outs of your insurance. So that's another good place to try.
And I do want to say, having been at my sister's side more than 11 years ago when she was first diagnosed with breast cancer, the cost for these genetic tests, and we're talking about maybe just 3 of them, were in the thousands. So we've come so far that I just get so excited by this pricing, and I know it's just going to come down further and further. You're going to have probably home kits, just like we're seeing the push with COVID-19 and PCR and molecular testing. That's the same thing that I hope we'll see with genetics. But the tricky part is you really need to have good guidance because you could misunderstand what you're reading.
Exactly. Yeah. And if there's something known in your family too, we always, you want to test relatives through the same lab. You want to make sure they're doing the right test. You want to know the mutation. We worry about like the possibility. These labs are very good, but we worry about the possibility of like a false negative if you maybe use a different lab with different technology. We would hate for someone to, to have the wrong test ordered and interpret it incorrectly and not get the full benefit.
Well, I really appreciate your help at the end talking about the findageneticcounselor.org. And, Alzheimer's disease tends to be something that as we get older, we all worry about. Are there any other common diseases that you find people would really enjoy having some more information on outside of cancers,
Mm-hmm.
Alzheimer's, and
Trying to think. I get some questions sometimes, like with the Alzheimer's, the testing, they really say it's only probably going to find something if there's multiple people in your family in early ages. We see a lot of late onset Alzheimer's, and we haven't found all the genetic factors linked to that yet. Other questions people ask me about sometimes are pharmacogenetic tests. So,
yes.
tests that how you metabolize different drugs. And so you might need a different dose of a certain drug if you have a gene mutation that affects how you metabolize that drug. Um, I am not the expert in what to order for that just yet, but I definitely think that's going to be big in the future because it's going to impact drug response and what drug someone gets and how they're going to respond. So,
I do use that in my office, and
yeah.
I've had mixed results when we're talking to psychiatrists who some of them absolutely want to see it. Others want to see it because I have it, but don't want to lean on it because there's some complex interplays besides your metabolism with sometimes the ADHD meds are metabolized in the gut, but by different maybe bacteria and other factors. But we do see some children not responsive to their reflux medication, or they need higher dosing. It has been very useful for me, and I definitely think it's something to tuck away in their chart, and have now, because why not have it now? What it's doing is looking at a multitude of enzymes in the liver and seeing what your function is and which enzymes you do and don't have, and at what levels and what activity. And that's just going to be very useful, if not right now for certain meds, but for the future. So I think it's lovely if people have funds for it, and if they have a diagnosis, and insurance will pay for it. Insurance loves paying for it if you have a diagnosis where you need an expensive medication and we're not seeing the result we want. So that's nice to know. And for people who want to pay cash, it's my lab will do it for around $200 to $300, and it's very expansive and useful. So I do talk to people about having that,
Hmm.
because to me, if you have money, there's no better place to spend it than your health.
Yeah, yeah, that's a good point.
Thank you for bringing that up. I almost forgot to touch on that. And that's
Yeah,
pharmacogenetic testing.
pharmacogenetics. Yeah, those are kind of the big ones I get. Some people ask me about conditions that we think are maybe multifactorial, like there's a lot of diabetes in my family or something like that, where we don't have a single gene cause. We think maybe it's a combination of genetic and environmental factors, and there's no single gene we can test for, but we say maybe your risk is higher than someone without diabetes in their family because it's in your family, but your environment can also influence your risk. So those multifactorial conditions, there's more to learn on them for sure, but lots of people ask about the genetics for those as well.
Well, I love that this talk is going down in history, because in maybe 5, 10 years, we're going to look back and laugh, because we're going to
Yeah,
be so much more advanced. But
definitely.
for now, I mean, it's gone kind of slow, I think, because we need the public to pick up their interest and speed, and lobbying for insurance companies to cover these things. But the more people like you speak up, and I'm so grateful you were willing to. I know your department voted you the spokesperson, so I really appreciate you stepping up when they kind of threw you under the bus there. But I appreciate you being here today. Anything else you want to add before we say goodbye?
I don't think so. Yeah, if anyone, I guess just if anyone wants, if they're local and they want genetic counseling and testing or to talk more, they can look us up on Google Hoag and genetic counseling, and we do accept self referrals if you have a PPO plan, and if you have an HMO, you can ask your doctor for a referral. But yeah, we look forward to talking to you. You can just call us if you have questions, and we can help in any way we can. But thank you for the opportunity, and I'm glad we're getting more genetics education out there
Absolutely. Thank you so much. You have a wonderful day.
too.